The faith integration and healthcare research assignment is basically something that you're going to be working on throughout the entire course. And so, really, what you're going to do is turn in this particular assignment for points on week 7, but you're going to work on it throughout the entire course. So, each week in the syllabus for weeks 1 through 6, you will see an assignment that says reflective journal. The reflective journal all contributes to this faith integration and healthcare research component. So basically, what you'll do is after class each week, you will work on journaling kind of your thoughts on some of the class concepts like trust, integrity, justice, purpose, fairness, health, equality, anything like that. And basically, what you want to do is think about how that course material was covered that week. So that can come from the discussions we have in class, that can come from the textbook, that can come from any of the articles that you've read, that can also come from any of the kind of research you've done on your own related to course content, especially as you're working on other projects in the class. So what you want to do is basically think about how those topics, those broad topics like faith, justice, fairness, equality, etc., how those topics are presented in our class material, either from discussion or from the textbook or for readings, and also how those really impact your own faith and spirituality, and really how you see that contributing to how you're going to practice public health. So basically, the idea is that in weeks 1 through 6, you'll see an assignment that says reflective journal. That's not necessarily something, the journal, that you need to turn in. You absolutely are able to, especially if you want to have an organized place for accountability, but you can create that however you want. That can be a Word document, that can be a OneNote document, that can be a handwritten journal. It really is just a place for you to gather your thoughts each week so that over the course of the class, you have a repository of places that you have been reflective upon the course material, as well as your understanding of spirituality and how you're planning to integrate these into your public health practice. And then basically in the week 7, that's when you're going to turn in this assignment. And that's your faith integration assignment. So basically what you're going to do is you're going to compile your thoughts that you have completed in those journals from weeks 1 through 6. And then you're either going to write a reflective paper or you're going to do a digital storytelling video. If you're not sure what a digital storytelling video is, don't worry, we're going to discuss in class. But it's in a way that you can basically present that information in maybe like a video blog type feedback. Then you will turn in this assignment on week 7. So when you look at the syllabus and you see assignments for weeks 1, 2, 3, 4, 5, and 6 that say reflective journal, those aren't assignments that have points associated with them because you don't actually have to turn them in. They're just reminding you to complete those activities so that when it gets to week 7 and you turn in your faith integration and healthcare research assignment, you have those reflective journals from weeks 1 to 6 to reflect upon. And so make sure that you are keeping those journals. Once again, you don't have to submit them to me unless you want to, unless you want a place to keep them organized or you want to maintain accountability. You're welcome to. And especially if you want feedback, I'm happy to read them and provide feedback for you. But don't feel like you have to turn them in. It's just a reminder that you should be completing that journal after the class period, basically just reflecting upon the concepts in class, how those impact your spirituality and faith, how those impact your public health practice, and understand that in week 7, you're going to put those ideas together into an assignment that will be the faith integration and healthcare research assignment. So those reflective journal entries are all part of that assignment. So if you're wondering why you don't see points for those weeks 1 through 6 journals, it's because those points will be part of that week 7 faith integration and healthcare research project that you will turn in. I hope that this helps clarify the expectations for this assignment. I also just want to make it clear that in nowhere in this assignment do you need to have any peer-reviewed research cited. It doesn't need to be an APA format unless you turn in the reflective paper, but your journal entries, they don't need to have citations. They don't need to have any type of APA format to them. Your paper that you turn in for faith integration and healthcare research, that will have an APA format to it, but you don't need to have any citations. So this is more just a reflective opportunity to think about the concepts in class and how they basically cause you to reflect upon your faith, your spirituality, and how you think you're going to use public health in the future. So I hope that this helps to clarify the expectations of the assignment. If you'd like to have any further information, please feel free to reach out to me. I'm happy to have one-on-one discussions, and I'm also happy to meet with you over Zoom or over email or face-to-face in order to discuss this more depth if you have questions about how these assignments are going to come together into one project that you'll submit in week 7.